Hello, my name is Jill Berry-Bowen, CEO of Northwestern Medical Center, and your host of the NMC Health Beat Show, dedicated to discussing important healthcare topics of interest to our community. Today, I'm joined by Jonathan Billings, who oversees NMC's strategic planning as well as community relations and Rise Vermont. And we're talking about plans of how we're going to evolve the campus. So thank you, Jonathan, for being here with us today.
My pleasure. Happy to be here.
It's always a fun topic of what's happening at Northwestern Medical Center, because we just finished or are finishing up what we call the master campus plan, the kind of the big project that everybody sees and hopefully is enjoying. So tell us, where is that project at? Is it really done, and are we wrapping that up?
We are nearly done and heading into the wrapping it up process. The new inpatient rooms, the all private rooms, are fully functional and are as wonderful as we hoped. The reaction from our patients and the families about having the privacy and the space to heal and recover and support their loved ones is everything we were shooting for, and so we're thrilled with that. The medical clinic space is now open, and our women's services is in their new space. Our lifestyle medicine department is now seeing patients in the front of campus, and we will plan to be opening a neurology clinic in the fall and expect more specialty services occupying that space as we go forward. And then potentially the most visible to the community is the medical office building right at the front of campus. That is open and operating with convenient parking right at the front door that our patients love, and our valet service helping as well. That hosts primary care, urgent care, our ortho and rehab center, as well as our outpatient lab, all at the front of campus with a focus on ease of access and efficiency and integration. And so we're thrilled. The last remaining piece that is really visible to the community is the healing garden. Now that we are headed into Vermont's growing season, we are doing plantings and creating a wonderful healing garden for our inpatients, so that as patients are in the hospital recovering and healing, returning to their wellness, they can actually go out into a garden for a bit of nature and fresh air and escape the hospital building itself. So we're really excited to have that, and that will bring the project to completion, and I think we're thrilled that it will be coming in under budget as well. So some real good stewardship on the part of the facilities team and the engineers and the architects for the project.
And it went pretty well, right? Like you said, on budget, so on time, on budget. Does that fit?
That does fit, and it's remarkable for a hospital to change where its main entrances are temporarily and to move services around. Our community was remarkably patient with us. Our communications team worked very hard to keep people informed. Our clinical staff were remarkably flexible, and patient care continued.
Yes.
And it's been a remarkable period to go through this construction on campus, and it's wonderful to be at the point of we're doing the final plantings to bring it home.
Yeah, it's it seems like in talking with folks that people are enjoying having things right at the front door, so to speak, the easy access and what we had hoped for. People seem to be enjoying the space. So it's more than just kind of showing up for an appointment. It seems to be a space that people are really enjoying.
We're seeing a lot of connections between providers, a lot of satisfaction from patients, things that we hoped for in the design process that we're now seeing come together and happen. And so that's a real thrill that it looks good on paper, but when you build it out and people occupy it, to see it work even better than hoped is a real pleasure.
Yeah. So there must be something coming next, right? I mean, we never stop, do we?
That is one of the beautiful things about Northwestern Medical Center, is that it is a forward-looking organization and is always trying to keep pace with community needs. And the next big priority for us that has been identified through our processes is the emergency department. It's a design that's more than 20, probably headed towards 30 years old.
Right.
And it's tired. Medicine has changed, our community needs have changed, and so we have been working through a plan with our clinical team, headed by Dr. John Minadeo and longtime nurse manager Joanne Manahan, to look at the emergency department's needs. And we're headed into a project that will improve privacy for patients, improve safety for patients and staff, and create more efficient modern workflows that will expedite care and improve our ability to really provide exceptional services in emergencies. It will be a complicated project, and it's a project that requires state approval. And so we will be headed into a certificate of need process, and then we will carefully stage it so that services are not turned off during construction, but the community continues to be safe and maintained as we go forward amidst a wonderful renovation project.
Now, I know that in addition to the emergency department, there's also other planning going on as well. So when you think about the true hospital campus, we're no longer really a hospital, but how do you describe the campus?
Sure. It's growing and evolving, and I've actually had the pleasure of seeing much of it happen, and I've been part of the hospital leadership team for 28 years, and when I first came, we had two facilities, one downtown and one at the top of the hill, and then we consolidated the top of the hill at the top of Fairfield Street in St. Albans, and it's grown since then. Our board has looked to the future and anticipated community need, and the campus at Fairfield Street now includes our hospital proper, as well as the new medical office building, but also the doctor's office common, two L-shaped buildings that house many of our local community physicians. Behind the hospital is Cobblestone Health Commons, a two-story medical office building that features our rehab services department right now. They have some great space back there. Our lifestyle medicine has a presence back there. It's a great building with some really interesting possible future uses. And then Northwestern Counseling and Support Services main building is on our campus. If you think of the land that the hospital owns, they own their building, but we host them on our campus. And that's wonderful proximity and opportunity for integration. We love having them on campus. But our campus has gone beyond that patch of grass. And we now have physical presence on Fisher Pond Road, on Fairfax Road, on Fairfield Street, for both physician offices and other offices, and actually some overnight housing for physicians when they need to stay over. We have locations in St. Albans for some of our services on Kingman Street and Lake Street and North Main Street. But we've also reached out into the outlying communities to make sure that we have good access with satellites in Georgia, Vermont, in Swanton, and in Enosburg. And so when we talk about campus, it blends out into our entire community, and it really is about meeting community needs by what services need to be where.
Exactly. Yeah, it's great to not only have people coming to us, but that we are out in the community. So I think that's great. So your title is Vice President of Planning and Community Relations. And so let's talk a little bit about planning. So what do you do for planning? So maybe tell us a little bit about your role in the planning piece, and then how do we go about planning for our future?
Sure. Planning is a team effort. It's not something where one person wanders off into a dark room and emerges with a document and says, here we go.
Right.
And so I like to think of my role within planning as coordination or facilitation or orchestration, and we're fortunate to have wonderful support through a management company named Quorum Health Resources, and that brings in expertise that supplements what we have in-house, and it really is all founded on our community health needs assessment. It's a process we go through every 3 years that takes a very organized and scientific look at both the qualitative data and the quantitative data. So what do the numbers tell us? What do the statistics tell us? Where is Franklin County headed? Where's Grand Isle County headed? What are the health needs? And then also looking at what are local priorities, involving our community and community leaders and the public at large in what's important to us, what are we worried about, what are we concerned about, what needs to be addressed, and working through a process. You can see the document on our website. We go through the process every 3 years, and it results in a community health needs assessment that identifies priorities that become foundational for us as we look at the planning. That, okay, if this is what is important in our community, what's the priority, what's our role, and how do we go about meeting that?
So the community gets involved in our planning?
They do. We receive significant input from our patients, but we also have surveys that we use to gather input. There are typically public meetings where we're out in the communities talking to folks and gathering their insights. And then as we move through the process, there's actually a group of local leaders that are part of the process that help prioritize what are the needs so that we can focus.
Great, so the community really does direct our priorities.
It does. It is rooted, we are truly, I consider us truly a community hospital.
Absolutely.
Rooted in community priorities.
So what's rising to the top? I mean, do we have any sense of what's happening and what folks are wanting? It's
been interesting because we have taken our community health needs assessment and then moved through our strategic planning process and are now in the master campus planning of if these are the priorities of the community and this is where the hospital needs to be strategically to care for our community, what do we need for our campus? And we talked about the emergency department, and that kind of is on its own level. And so it's moving first and fast, and we're excited about it. Coming through the process, a number of other exciting projects have risen to the top. Integrating our addiction services and improving our access to mental health services. And how do we do that on campus? And how can we wrap around patients with these unique needs and really help them recover and move forward? And so I think you'll see effort there. We have an exciting opportunity to create a wellness pavilion. There's a lot of energy around prevention in our community with Rise Vermont, the movement to embrace healthy lifestyles, with the work of Dr. Fontaine and the lifestyle medicine team about helping people with secondary prevention, and the Blueprints work around managing chronic disease, that we have an opportunity to really create a central area in the community where folks can go to get started on their wellness journey. It's been a lot of, we have 2 facilities in Georgia. And there's an opportunity for efficiency and integration to consolidate our primary care presence and our urgent care presence in Georgia. And so we've been working with that municipality about what the future might look like there. Notch, our federally qualified health center, is looking at consolidating their practices in St. Albans and coming onto our campus.
That's wonderful.
It is.
I love hearing it.
Wonderful opportunity for their integration, for improvement of access to primary care. And so much of what we do is about access to primary care and getting people into that relationship. So having Notch spotlighted on our campus, I think, really helps that.
It's wonderful.
Internally, we're looking at how we do surgical services and how we can be even more efficient and how we can adopt kind of that ambulatory surgery mindset and really be patient-centric in that. And that's a bit of a change for a hospital surgical services that has been traditionally inpatient. As medicine evolves and more is outpatient, we need to change our processes in our space to support it, and so that will be coming. And then as we look at the changing demographics in Vermont and in our corner of Vermont, our population is aging, and that brings its own unique set of challenges. And so we're exploring geropsych and what kind of mental health needs are present in our seniors and how the hospital might play a role in that. And at the same time, you've got roofs and heating and ventilation and air conditioning and electrical systems and parking. And so within the planning are all of those pieces, and you can't forget your medical equipment. So it's quite an undertaking as we look to the future to line these up.
Wow. You're not bored in your work, are you? After 28 years, you're still rocking.
That is one thing we are confident about Northwestern, that we are always moving and looking to better meet the needs of the community, and it keeps us busy and engaged.
Oh, wow. Our time has just flown. We could talk about everything that's going on. So just in our last minute, what are the next steps? What do you want the community to know that's listening here? How can they get involved?
We are early in the process. All of those ideas I just thrown out need to be vetted and built out, and they'll head through an internal approval process. These have not gone to our board yet. They will need to go to our board, and then many will head to the state. So if something has caught your ear or your eye, we'd love to talk to you. You can reach out to the Community Relations Office at the hospital. We'd love to take your input. There will be community sessions as the various projects move forward, and we'd love to hear from you because it really is about the community and the community need.
Excellent. Well, thank you so much. I know you've been on here a few times. You're excellent. Everybody loves to hear from you. And I want to be able to tell this whole community how much I value you on this team, because you're making me look good all the time and setting me up for success and doing all this planning and work and really helping us cast our net out into the future and all about providing exceptional health care for our community. So you live that mission, and I want to thank you for that.
I appreciate it. It's a joy to be part of it.
Yeah. So thank you for joining HealthBeat today and learning about the projects going on at the hospital. And I know it seems to be big, but you know, when you come in, hopefully you'll find it's very welcoming and warm, and that we are your community hospital, providing the services that you need most to stay and have your care locally. So thank you for joining us today.